I'm Joe Hunstad, and today we're going to be discussing some specifics of the temporal brow lift. We have a very nice patient here, 64 years old, who you can see has really strong animation lines raising her brow because I think she's feeling skin-on-skin contact. She's also a really great candidate because she has a very low hairline. The temporal brow lift is a very effective and predictable method of brow elevation. We've been using it for many years, and in most cases for us it's replaced the endoscopic brow lift that we were using previously. The markings for a temporal brow lift are as follows. We identify the brow, here close your eyes, and we want to see what we want to elevate. We want to elevate the tail the most, the center a little bit less, and the head the least. The nice thing about the temporal brow lift is that it doesn't cause the head of the brow to spread, which can occur, at least in my experience, more commonly with endoscopic brow lifting. So we measure and mark the hairline because this is a key element in understanding of the mechanism of the dissection itself. The second mark is to identify, here close your eyes for a second, exactly how much brow elevation I want to achieve. With her it'll be quite significant. Right here in repose, her brow is at or slightly below the bony rim, where in a perfect world we'd like to see it approximately a centimeter above the brow, which is ideal in brow aesthetics. Now that we've identified the amount of brow elevation we want to achieve, we're going to go back behind the hairline to determine our final incision line, which is going to extend from a point of the lateral brow basically up to the center of the brow itself and possibly a little bit more medial to that. And the distance between the incision and the hairline, which is where we enter the galea, is a determinant because we want to identify how much we want to lift here and transpose that to this length as well, because that will tend to give us that degree of elevation when we approximate the galea, the cut edge of the galea, to the periosteum and the galea superior to the incision. Now that we've marked the hairline and the desired incision, including the width of the incision to the point of going superficial, we will mark the extent of the undermining. And this is typical because we want to be sure we get to the tail of the brow, which is the most important point for elevation. So just to review, we've determined the amount of elevation we want for the brow. We've got the hairline marked, the proposed incision, and again, just to go through the procedure, we go through the galea to the lucerular plane, the subgaleal approach, until we reach the anterior hairline, and then we go superficially in the subcutaneous or the subdermal plane to reach the brow, and that protects the frontal branch of the facial nerve because we will be superficial to it in this area.